Hello everybody. Today we're going to talk about the proper way to put on or don and take off or doff PPE. One of the things to remember is that even with the COVID-19, everybody's requirement for PPE may vary depending on your specific job. I am going to go through all the components of what we would have available that may be used by some people. So the first thing that we're going to do before we get started, and before you always get started, is to make sure that you use hand sanitizer. I want to point out that I have no jewelry on, and the reason I don't have any jewelry on is, especially in this time when we're so worried about contagions, we want to make sure that we can clean our hands thoroughly, completely, and dry them completely. As we all know, sometimes it's very hard to get underneath rings and make sure that they're dry. So again, the first thing you're going to do before you get started is to make sure that you use hand sanitizer. We have to remember that just with the way we always take care of patients, that hand hygiene is one of the most important things that you can do. So the first thing that we're going to put on for our PPE is our gown. So we're going to take our clean gown and we're going to put it on. And it's really easy to put on when everything is clean because your hands are clean, and so you're not really having to worry a whole lot right now about what you're touching. However, further into this video, you'll see that it definitely becomes an issue and that we need to be very careful. So we've got our gown on, nice and secure. The next thing that we're going to do is put on our mask. So the mask that I happen to have right here is one that has the metal piece in the top of it. Some of them do, some of them don't, it depends. So what you're going to do is you're going to take the clean mask with the metal piece and you're going to press it tightly around your nose so that it's very nice and tight. Then you're going to take it and put it over your ears, and you're going to pull this down so that it completely covers your chin. So you've got your nose and your mouth completely covered. So then you've gotten your gown on, you've got your mask on. The next thing you're going to do is put on your goggles. So you put your goggles on over regular glasses. Regular eyeglasses are not to be used for safety glasses. You can use eyeglasses, safety glasses, you can use goggles, or you can use a face shield. The next thing that you're going to put on is your gloves. So again, you're going to take your clean gloves, you're going to put them on, and you're going to make sure that you cover the wrist of your gown. So you completely cover it like that. So now you've got all your PPE on that you're going to be needing. Again, your PPE will vary depending upon the job that you're required to do. So the next thing that we want to talk about is doffing or taking off the PPE. So the first thing that we're going to do when we're taking off our PPE is that we're going to take off our gloves. So what you're going to do is you're going to pinch the glove like this, or in the middle, and you're going to bring it so that it's inside out, like that. Now you've got a clean hand, and all of this is considered dirty. So then you're going to take a finger and you're going to put it on the inside of your glove, and you're going to bring it around like this, and that's inside out. And then you throw it in the waste receptacle. The next thing you're going to do is you're going to remove your goggles. Your goggles or your safety glasses must have your name on them, and we'll talk about that in a minute. You're going to remove those and put them down. And then the next thing you're going to do is to remove your gown. So you're going to take your gown off. You're going to untie it. The only part that's clean, or that you presume is clean at this point, is the back. So you undo the ties, and then you take it from inside and you bring it down like this, and you bring it down over this sleeve. So now it's inside out, and you're rolling it up inside out so that you're not touching any part that could be contaminated, and you throw it away. And then the last thing that you're going to do is take off your face mask. Again, things aren't clean anymore, so what you want to do is not touch the face mask. You want to make sure that you just take it off by the ear loops. And then you're going to place it face down into a tray. This tray must have your name on it. So this is how you would use your PPE. Now, I chose not to use a face shield, and the reason I did not use a face shield is that for me, it tends to fog up more than using the safety glasses with the mask. So sometimes it's personal preference, and sometimes it really depends upon what you have available and the job that you're doing. So that's how you put on and take off, or don and doff, PPE. When you're all done with that, you want to wash your hands or clean them with hand sanitizer. You have to remember that cleaning your hands can't be done enough. So one of the other things that I'd like to talk about is the reuse or extended use of equipment. We all know that right now it seems difficult to get the equipment that we need. It's going to hospitals who are at very high risk, need to have the equipment, so we're trying to use what we have and get it as we can. So there will be times when you are going to have to reuse your equipment. You will always have to reuse your safety glasses or your face shield. And so the safety glasses and the face shield need to have your name on them so that nobody else uses them and puts them on their face. The other thing to remember is that if you're reusing these, you've taken off, we'll use the safety glasses as an example. You've taken it off, you've put them in a tray. So not only do the safety glasses have your name, but the tray has to have your name on it so that we know that that's yours. The same thing with the face mask is you want to make sure that the tray that you put the face mask in has your name on it. You also want to make sure that the face mask, which is going to be reused, maybe after my lunch, that it is put with the contaminated side down and the clean side up. When you go to reuse the face mask, when you're doing the proper PPE donning, you want to make sure that, again, you clean your hands, but this is now contaminated or has to be considered contaminated. So you're only going to touch the ear loops to put it on, okay? When you take off your safety glasses or your face shield, you need to make sure that you use a wipe to clean them because we want to make sure that they don't have any contaminants on them and so that you can see well, so you can see what you're doing. So that is the way that you put on and take off your PPE, what equipment we have available or you may have available, and how to reuse or extend use for your PPE. We're going to open it up to questions now.